Welcome, everyone, and thank you for joining us for another UMiami Health Talk. The title of tonight's chat is How to Make the Most of Your Telemedicine Consultation. I'm health journalist Ileana Bravo, and I will be your moderator for this evening's program. Tonight, we're delighted that we're going to hear from Sylvester Comprehensice Cancer Center's Dr. Frank Penedo and Dr. Estelamari Rodriguez. Together, they're going to present on the benefits of telemedicine for cancer patients, especially right now in the era of COVID-19. And we're going to cover some tips on making the most of these types of visits. Now, we remind you that to schedule an appointment, you should do one of the options, either visit sylvester.org or call 1-844, we'll put this up on the screen again, 324-HOPE, which is 4673. But during this presentation, we're also going to poll the audience on questions relevant to this discussion. And we ask that you become an active participant and answer the poll questions because it's important to the body of the conversation. We're also going to have a question and answer session that's going to take place at the end of the presentation, and you can submit your questions to us and we will look at them, we will preview them and tee them up for our experts tonight. Some of you have already submitted in advance, and those who haven't, no worries, you have plenty of time. Take a look at the bottom of your Q&A of your Zoom screen and locate the Q&A little buttons, and that's where you will enter the questions and we are going to present them. So I'm pleased to introduce one of our presenters, Dr. Frank Penedo. Dr. Penedo is an Associate Director for Cancer Survivorship and Translational Behavioral Sciences at Sylvester Comprehensice Cancer Center and a professor of psychology. He trained as a clinical health psychologist at the University of Miami and completed a clinical residency in psycho-oncology and behavioral medicine at the University of Pittsburgh. His research focuses on developing and delivering interventions to improve health-related quality of life and other patient outcomes, including in-person and via telehealth. Dr. Penedo is also the director of the Cancer Survivorship Program at Sylvester. Our other presenter for tonight is Dr. Estelamari Rodriguez. Dr. Rodriguez is a triple board certified hematologist and oncologist at Sylvester Comprehensice Cancer Center. She completed her residency in internal medicine at Columbia University's New York Presbyterian Hospital and medical oncology fellowship at the University of Pennsylvania. Dr. Rodriguez also has a master's degree in public health and has a special interest in the early detection and treatment of lung cancer and how cancer affects women. Again, our co-presenters tonight will be sharing the benefits of telemedicine for cancer patients. And with that, I hand it right over to you, Dr. Penedo. Take it away.
Thank you, Ileana. Good evening, everyone. It's a pleasure to be here this evening and have an opportunity to talk about the benefits of telemedicine. Tonight, we're going to cover several topics, starting with a brief introduction to telemedicine and e-health tools. We'll discuss the rise of telemedicine during the COVID-19 pandemic, something that's impacted all of our lives in one way or another. And we'll touch upon a bit on the advantages and some disadvantages of telemedicine for cancer patients. We'll provide you with some tips to make the most of your next telemedicine visit. And then we hope to have plenty of time for an open question and answer session. So telemedicine, telehealth, and the different terms that we use to refer to basically using technology has been growing over the past several decades. In the past decade or so, there really has been a growing interest in how do we capitalize on all these advances that we have in information technology to be able to provide quality and patient-centered care to cancer patients and survivors outside of the clinic setting or outside of a hospital. Telehealth and telemedicine are really not recent innovations. They've been around for a bit of time, but they continue to evolve with advances in communication and information technology. With the widespread use of computers, tablets, and smartphones that we all love, the delivery of cancer care via e-health platforms or telehealth continues to expand, and this trend has accelerated dramatically this spring due to COVID-19, where we really were forced to change the landscape of how we deliver clinical care in the United States and in fact around the world. Before we get into the details about telemedicine, I think it's always good to clarify some of the terms or the names that we use to refer to these technologies, if you will. Telemedicine itself, it really involves the broad use of health information technology and communication. We tend to hear about telemedicine, telehealth, mHealth, and eHealth. What all these have in common is that these service platforms to provide remote delivery of either a health assessment, either monitoring a health condition, or providing direct patient care and care delivery. Of course, mHealth is more specific to using a tablet or a smartphone, and many programs, as you may be familiar with, are now available to track your physical activity, your nutrition, and also through the Sylvester patient portal, we can track appointments or schedules, lab results, etc. Using of a tablet or a smartphone is that mHealth technology that allows us to access that information. eHealth tends to be a broader term. It's typically it's something that a source of information that's based on a web portal, and then telemedicine and telehealth get more specific into the details of providing patient care. So if we look at this a little bit deeper in terms of the taxonomy or the different terms that we use, so now we're going to focus on telemedicine, which is remote patient care and monitoring. But telehealth serves many purposes, and the benefits have been that because of the wide application of these technologies, a lot of research has taken place over the past 10 years or so, have documented not only the feasibility and acceptability of these technologies for patients, but also their utility and how they can promote better patient outcomes. So if we look at telehealth in general, it encompasses teleeducation, which could be programs that are available via the web or through a smartphone application that talk about patient symptoms, what to expect during a visit, treatment-related side effects. And the patient portal, as I mentioned earlier, is more specific to how do you manage your appointments, looking at your lab results, communicating with the health system. Telemedicine, in contrast, is a bit broader, and it really is specific to either having interactive patient care, which Dr. Rodriguez will talk about in detail today. It can involve remote patient monitoring, assessing symptoms, toxicities of treatments, or concerns or needs that the patient may have, and also can serve a function to store information and reports that can be accessed in the future.
If you're just joining us, we have our first poll question, and I wanted to welcome the new people who have jumped on this Zoom call. You're hearing from Dr. Frank Penedo and Dr. Estelamari Rodriguez of the Sylvester Comprehensice Cancer Center. And here's our first poll question of the evening. Have you had a Sylvester telemedicine appointment in the last year? And you have a chance here to answer on your screen. It's a yes or no question. And that gives us an idea of where you are as a patient in the system, whether you've already had a telemedicine appointment in the last year, planning to have one, thinking about having one, considering one. And I think we do have the results. So there you go, doctors. 53% say yes and 47% no.
So a little bit over half of our attendees tonight have had a telemedicine appointment in the last year. We're curious to hear comments and questions during our Q&A about the experience. It looks like another half have not had those appointments. And as Dr. Rodriguez will explain, these appointments really don't replace face-to-face medical care. There are several instances where it's necessary for the patient to be on site for their medical visit. So I wanted to make a few comments about the use of the internet and particularly how it's been used not only in the general population, but also in cancer population. These are statistics or rates from the Pew Research Center, which have documented that up to 70%, that's 2 in 3 cancer patients, seek medical information online via the web. And this is pre-COVID. This is just reflecting the fact that the use of the internet has been a major resource of information for cancer patients who want to learn more about their condition, treatment options, disease trajectory, and other components of the cancer experience. And I think it's very interesting to see also that almost a third, or about a third, of cancer patients have sought support programs to help them address the multiple unique and complex challenges that cancer patients face upon a diagnosis and upon treatment. Touching upon the COVID pandemic, really the importance of the internet and web-based information during the pandemic was recently highlighted also by the Pew Research Center, where it showed that almost 90% of all Americans reported that the internet was an essential or important source of information for them during the pandemic. And this it's not surprising to us because accessibility to the internet has grown. In fact, going back only 10, 15 years ago, there were concerns about whether even older adults would be using the internet. And we now know better. We actually use adapting to technology and ability to use the internet as one of the many capacities that we see that older adults can engage in. So use of the internet is pretty ubiquitous, and it can certainly become very useful during situations like the COVID-19 pandemic. So, one of the silver linings that we see in the challenges that we face today in cancer due to COVID is that these advances that I keep referring to in terms of e-health and health information technology have really provided what was once an unimaginable but yet necessary route to be able to maintain continuity of care while promoting the safety of patients and the safety of healthcare professionals alike. The pandemic really has presented health systems with this major challenge regarding patient and employee safety, where we want to, of course, have continuity and provide exceptional care to our patients, but we also want to protect our patients and protect our care workers. So many routine cancer care, cancer exams and follow-up appointments have been moved to telehealth sessions, as almost half of you, or a little bit over half of you, indicated in the poll. Whether comprehensive cancer care can be delivered effectively during telehealth is a key concern for us. We want to hear from you, and we want to make sure that our patients figuratively walk out of these telehealth appointments feeling that they received the care that they're used to receiving at Sylvester. But what we do know from the research in this area, if we draw from programs that have evaluated the utility of e-health, providing information, support, a service that's health-focused through technology, we know that these programs can be effective. And a lot of the research is really focused on looking at quality of life or reducing symptom burden or providing information about cancer in general, health behaviors, treatment, follow-up guidelines, and other factors of importance. So what do we know? What is the evidence that we have about this remote care or remote provision of services? Well, we know from a variety of, actually a pretty robust list of research studies, that e-health can be successful in delivering services. Telemedicine has been shown to improve a whole set of patient-reported and clinical outcomes. The patient-reported outcomes that have been most studied and shown to be favorably impacted by delivery of services through telemedicine are fatigue, depression, quality of life. We have also been able to show, or the scientific community has been able to show, improvements in treatment compliance or sustainment of treatment compliance, as well as monitoring symptoms, toxicities, and other treatment-related side effects that may impact the cancer patients. It is true that most studies have really focused on psychosocial factors and monitoring symptoms, but again, now we're in a very accelerated trajectory of research where investigators across the United States, across the world, and here at Sylvester are gaining more knowledge and understanding what are the best practices and best models of care for telemedicine for our patients. So you'll have to stay tuned on those studies. Those studies are fairly recent and aligned with the pandemic, but we're collecting quite a bit of data on satisfaction from the patients, on the delivery modes that are being used, and other factors that are going to help us optimize the delivery of care.
So that's the perfect transition for our next poll question. So all of you out there listening to this and watching this Zoom webinar, please participate. What do you think is the best feature of telemedicine? These are multiple choice answers. Convenience, the slowing spread of infections, such as social distancing, the opportunity for family to join in a telemedicine visit, cost savings, less commuting time, parking fees, childcare, gas, etc., or improved access to care. So take a look at your screen. We have plenty of time, read it. In the meantime, I remind you, there's so many of you on here that is important for us to hear from you. Please enter your questions in the little Q&A feature box at the bottom of your Zoom screen. It looks like two little thought bubbles and says Q&A. We really want to hear from you and participate and present questions to these expert providers whom you have the privilege of listening to tonight. We're very fortunate to have them with us this evening. So let's see how this is mapping out. I think we're still collecting. Whether interesting to see how it's but convenience and slowing the spread of infection seems to be outpacing the other multiple choices, right, docs?
Yeah, absolutely. Let's see. And there you go. And, you know, convenience is a major benefit of the telehealth visits, not having to deal with traffic, parking. It saves time. If you're caregiving for a child, for a family member, you don't have to make arrangements. So there's a lot of benefits here that are at play. And of course, the social distancing component, although our cancer center and our hospitals and clinics are taking every necessary precaution to protect our patients, always having that, if you don't have the necessity to be in a place where you're going to be interacting with other individuals, it provides that social distancing that's so important to mitigate the spread of the virus. And interesting, improved access to care, while not one of the big ones, it's something that also stands out. And that's something that, again, one of the silver linings of having to make this pivot, if you will, to telehealth is how can we use these now commonly used modes of care to improve access to our patients that otherwise wouldn't be able to get the appropriate care. All right, so moving right along. So I think this is reflected to some extent in that survey that was just, or the poll that was just administered. What are the benefits and what are the limitations of telemedicine? We believe that the benefits do outweigh the drawbacks that we face, but as was mentioned earlier, the issues regarding distance, travel, traffic, and parking, caregiving commitments, having broad access to support services, and greater continuity of care, making sure that the appointments are followed, and sometimes barriers of access get in the way where a patient could not make an appointment as necessary. In regard to the broad access to support services, I think that's something that's very interesting. Many of you support services, who would have imagined we were going to be doing yoga online, that we would be doing some of the exercise classes or music therapy sessions through Zoom. And it's something that, again, we needed to adapt to, and we have been able to do successfully. And now those services, whereas in the past, you either were an inpatient or had to come in to a session, now those services are accessible through telehealth. Of course, the drawback, and I have a feeling Dr. Rodriguez will harp on this, in no way does telemedicine replace the in-person visit or the dynamic of sitting across a care provider to take care of your health. So there are some drawbacks here, and technology access. Not everybody has great broadband access. Not everyone has the latest technology, but that is changing with time. And as, again, we continue to see this unprecedented growth in technology access throughout the United States and beyond. So with that, it is my pleasure to pass the presentation on to Dr. Rodriguez, who's going to continue to talk about the value of telemedicine and get into more of the details of the encounters. And Dr. Rodriguez is an oncologist, is in the trenches and the front lines of this work. So look forward to hearing her take on telemedicine. Dr. Rodriguez? And Dr. Rodriguez, you might be muted.
Okay, great, thank you. So I'm Dr. Rodriguez. I'm an oncologist. I take care of lung cancer patients and breast cancer patients, mostly in the Deerfield office and also in the Aventura facility. And I will be talking about telemedicine from the perspective of the provider, how I seen it has changed our practice, and how I seen it has benefited our patients over this period of COVID. So the value of telemedicine for us as providers really has been to improve the care of patients during this very difficult period and be able to provide patients with what they need, especially when we were disconnected during COVID. So next slide, I will show you nationwide. In the next slide, you can see that the telemedicine utilization during the COVID pandemic really started in the beginning of the spring when we were closing down facilities, but we still needed to take care of patients. So the lower part of the curve is really the in-person visits only. So you saw how in March and April, a lot of centers nationwide had 70% drop in in-person visits. And then over time, the top line talks about how many patients were being seen by telemedicine. So the difference is really how we were able to meet patients when we needed them with the use of telemedicine. And that really has allowed us to continue taking care of cancer patients. Next slide. And I see that telemedicine has really served a great role in different stages of the cancer care continuum. So sometimes patients come to us, to our center for services that are before they get diagnosed, either a cancer screening for lung cancer, a consultation to plan for a colonoscopy, or patients that have a family history of cancer and need genetic counseling. So this used to be a service that we will have to bring patients in, and now we're able to meet patients with telemedicine to provide these services before they get diagnosed with cancer. We also have had patients that have come out to us for second opinions before they become our patients, and we were starting to establish care. And this is important because during the whole pandemic where in-person visits dropped, there has been almost a 64% drop in routine screening. And we're hoping that telemedicine will help us meet the demand for the screening that got missed during COVID, because we can meet those services. Initial counseling can be done through telemedicine. Now, what I do in my clinic is mostly what we have been able to provide with telemedicine in our virtual clinics at Sylvester Cancer Center. So a lot of our patients who are on treatment, we need to routinely follow their symptoms and manage their toxicity. So we've been able to do this in very creative ways. We have patients that I'm sitting in Deerfield and they're getting treatment in Lennar in our Coral Gables facility, and we're able to talk to them via their mobile phone or their tablet before they go for their chemotherapy treatment, and we're actually in different locations. So I think it's been very convenient, and it has allowed us to connect with patients in a more routine manner in a way that we couldn't before. Then there are also services that we used to be very complicated to arrange for patients, medication refills that now we can do in a simpler way by our portals and our telemedicine visits. And we also have supportive care services, pain management services that can be provided by telemedicine. One thing that has been very neat for us is that our service allows us to review films so that we can open the images and review them with the patient through the telemedicine consultation. And sometimes family members can join in from different locations and also look at the images. So you're basically expanding the exam room to include a broader family who are maybe in different locations and be able to share more information with our patients. And then after cancer care, when patients have completed their chemotherapy, we still need to contact patients. And we, especially during COVID, some patients have canceled follow-up appointments, but it's important to continue to review surveillance scans and provide survivorship counseling and address any longstanding side effects from treatment. So this is something that telemedicine can help us meet the demand for survivors of cancer. Next slide. So we covered a little bit of this, but the advantages which we talked about are really, and the group here participated. So convenience was the number one. And I would agree that for our patients who have found it convenient, they have continued to do telemedicine consultations. Obviously, slowing the spread of infection has been a big driver of this demand for telemedicine. But I think the family participation and the lower costs are really significant. So we have patients that now can join a telemedicine consultation. They don't have to drive to a location, take time out of work, and wait in a waiting area for an appointment. Like it saves a lot of time to be able to arrange these visits from where you are at your demand. So it increases the patient engagement and the follow-up. The disadvantages, and I can go over many of these experiences, we hope these systems are created to be easier, but they're still not easy in the sense that sometimes the internet connection is down or your mobile phone doesn't connect with the camera. But what I have seen in my practice is that we can walk you through it. We can walk you through the device. We have different alternatives. Like if we are using our portal that uses Zoom and your computer is not connecting, we're able to use another program that is using your cell phone that's called Dosimetry. So I will think in almost every case that we want to achieve a telemedicine visit, that we have a video and we can connect with the patient, we're able to do it. It may take us the first visit a little bit extra time for the patient to get used to it and to arrange the equipment. But we have staff that is here for you to make that and to do a dry run if you feel uncomfortable of how you're going to connect to the computer. But I have seen patients at every age connect, and really once you get, it's like, once you learn, it gets easier and easier. I will see that, but regardless of that, there's still a big digital divide. We're very mindful of the fact that there are patients out there who don't have internet connection or who don't have phones that have cameras. And for them, the telemedicine consultation may be more limited. And those are patients that they still may want to come in or need to come in for their exam, because we don't want to in any way limit access to our patients. This is here to complement our care and to be able to reach patients. But if you don't have the capacity to connect, our offices are open to be able to do our exams in person. There are also some communication challenges. So some of us are wearing masks and are talking to the computer, and it's hard to hear. For you to hear us, or for the patients who are hearing impaired to hear the visits by telemedicine. So there are specific cases where we try it and it might not work, and we have to move to the in-person visit. Next slide. So I guess the next poll question.
Right. So this one is the one that's sort of like a mini test. So Dr. Penedo and Dr. Rodriguez, here's the question we're going to ask and see what you all think of this. But all of the following can be done by telemedicine except, and here are some of the choices. Everything can be done by telemedicine except chemotherapy symptom monitoring, nutrition counseling, pain management, medication refills, review of abnormal imaging findings, and physical examination. So we're going to let our expert presenters weigh in and give us the answers here. But clearly, I think that our participants are savvy and are going to know, based on the wonderful presentations that you've given them so far, what is and isn't possible through telehealth and telemedicine. And I remind you all, by the way, out there, we have many, many participants hanging on to all. There you go. So they did well.
Yeah, this is great. So, I mean, you all got an A on the test. So physical examination, it's really the biggest drawback and the limitation of telemedicine. Although I will say that and Dr. Penedo, hinted to this, that we're doing research and trying to develop ways for assessing the patient at home. And sometimes, although we're not able to physically examine the patient, we're able to get a temperature that you can provide to us and show us. We can do blood pressure monitoring at home. We can, with our videos, we can get a good assessment. People have shown us taking pictures of rashes or new lesions or new lymph nodes, something that they're concerned about. And we might not be able to palpate, but we get an assessment and we tell the patient, you need to come in, we need to look at this closely. So physical examination obviously is what we need to make an assessment, but a lot of it the initial assessment can be made by telemedicine. Pain management, we can do online. I mean, we have pain management specialists that can meet with you and come up with a plan. And then pain management is a process where you initially have to adjust the medications, and this is a great opportunity for telemedicine. Sometimes it's hard to get into these clinics, but telemedicine allows us to see more patients in a more routine basis. So this is a great opportunity for patients to get nutrition counseling, pain management. Medication refills is something that we've been doing through our portals for some time, and we continue to do. And then abnormal imaging findings. Sometimes reviewing a scan is a very stressful situation. And I have patients that I recommend that they come in, so we do it in person, because I feel that if we're gonna discuss something that is gonna really be upsetting in any way, or there are gonna be a lot of questions, it might be best to be there in person. But we have patients that feel very comfortable. We're able to open the films the same way that we will open them in the clinic, and we're able to spend as much time as we would in person to review those images. And I mentioned cases where I have reviewed images with patients and their children who may be in, I have one family that we review cases, and one family member is in California, another one in New York, and we're able to all together look at these images in this way, which is pretty innovative and good for patients. Next slide. So now I want to go over 5 specific tips that I want to give you to make your next telemedicine visit successful. So first of all, you have to sign up to your patient portal. And when you get your appointment, you have one of our assistants will be assisting you, and they'll send you an email. They'll send you information of how to sign up in the patient portal. Before the visit, you will be asked to sign the consent and download a Zoom application to your computer device. So that's if you do it through the portal. We have patients that cannot do it this way, and then we do it through their phone, and we're just able to send them a text message and open the visit in the phone. And also with the Zoom, if you cannot download the Zoom application, or you didn't have time to sign up ahead of time, we're also able to send you a text message with the link for the Zoom visit. So this we are able to do ahead of time and connect with the patient, but it would help you if you got familiar with the patient portal. Then your computer has to have a camera to really be a telemedicine visit, because we rely on hearing from you, but we also want to examine you in a way that we can interact better. So if your computer doesn't have a camera, then it might not be the best device to run the telemedicine visit. You want to have an audio connection, and we'll guide you through how to set that up and activate it in your computer. There are patients that ahead of time may need extra help. So if you try, you can practice the Zoom visit with your children at home and try to do a dry run. But you also, if you find that it's difficult and you need extra help, you can call our assistant to guide you through the process. There are patients that may need a translator, and it will be helpful if you tell us ahead of time, because we can have a translator also join the Zoom visit so that we can run the visit faster for you. And then it's important, for this to be a private visit, that you are in a private space, in a quiet space. So we want to respect your privacy. In our end, we also run it as a private location. Next slide. Can we see the next? Okay. Then the next one is something that I think is useful for any visit with a doctor. And it's that you kind of prepare yourself for the visit so that you make the most of your visit. Because, I have patients that they, sometimes the information that we cover is very overwhelming, and they just, they forgot to ask what they really wanted to ask. So it's important that you think ahead of time, or that you have another family member that joins the visit and takes notes, or at least brings the questions so that you can get everything you need. But you can make a list of questions. Specifically, what we want to know is what's different. If something's hurting you, what's the new symptom? When did it start? How has it changed? If you're on chemotherapy, have you experienced any new symptoms that we need to address? So we want to hear about your symptoms and what's bothering you, what's new. If you need any specific things like medication refills, if you need a referral, these are all things that it's better to write them down so that we cover them and address them. But if you do forget, you can always email us at the end, and we'll have one of our nurses or our assistants help you get those refills and referrals. And then there are things that I have found very useful with some patients. If you have Because one of the things that we have missed by not doing a physical exam is that we do vitals in the office, and that gives us very valuable information about how you're doing. So if you're losing weight, we might miss it by an evaluation by the camera. So, but if you are able to take your weight and tell us, my weight has changed, or is up or is down, that will be useful for us. If you have problems with your blood pressure in your treatment, and you can have one of these blood pressure monitoring devices at home, or go to the pharmacy or the Publix and record a blood pressure, that could be also information that will be useful for the visit. I treat patients that may have respiratory problems, and many of them with COVID also have bought this O2 saturation finger monitors that you can use, and you can give me an assessment of your oxygen saturation, and that may be helpful, any changes in your temperature. And also with your camera, you can take pictures of new findings, and we can evaluate those together. So I think there's a lot of things that you can prepare ahead of time that can make the visit better. Next. And I guess one of the things that what we're doing this meeting today is to really highlight that the virtual meetings are a safe space for us to accomplish all the things that we want to accomplish for you. So don't be afraid to bring topics that are difficult, goals of care. We're discussing a new treatment or a change of treatment. This is the right space to talk about the risks and the benefits of the treatment, how successful the treatment can be, what our expectations for the future are. If you have problems with pain management, this is an excellent venue to address pain management in an ongoing basis, so that we can tailor your medications so that your pain is managed better. They're also it's very important to address other symptoms like depression and anxiety. And this is the right space and a safe space to do that. If you need more time for psychosocial support, we have psychologists on staff that we can arrange telemedicine visits after your original visit with the oncologist. And there are times that we discuss advanced directives or wishes that the family may want to discuss, so we can address all of those as a conversation. So this is an open conversation, it's a safe conversation, and it's really your space to bring up any issues that you may have related to your cancer treatment and how we can help you better. Next slide. The other thing that I think is very exciting is that this is really making the visits for some patients better. So I think the fact that you can invite other family members without having to have family members take time out of work, or if you have family members who are out of state, that has been a new thing that I think has really improved the care and the quality of life for many of our patients, especially during COVID, where people have been doing social distancing. Being able to connect with the family, being able to connect with the patient where they are has been critical. It's also, you can communicate with different team members. So you might be meeting with an oncologist, but you might want to reach out to the nurse. You might want to reach out to the surgeon. So you can set up telemedicine consultations with different specialists and make that a more effective process. We also have some very exciting new multi-specialty clinics that are run virtually. One of them are the thoracic multi-specialty clinic that we run on Thursday. And it has been really amazing. We've been able to bring patients that have very complex care, that they need to talk to a surgeon, a radiation oncologist, a medical oncologist, bring the pulmonologist, all of them in the same visit virtually like we are today. We can have all the specialists be there at the same time. And I think for complex cases, you can provide better services by bringing everybody together in the discussion. And some of the other specialties that have joined us in this visits have been physical therapists, pain management specialists. So there's a lot of supportive services and providers that can join the visit and the consultation. We talked about reviewing imaging studies, which is great to do by telemedicine. And you can ask the doctor to please open the films if they can, so you can look at them. You might not understand them, you're not a radiologist, but we can guide you through and show you any differences. And there's also a new move to make the medical record open. And when you're in the virtual experience, more of your information, you can go in the portal, look at the lab results, review the pathology reports, and soon you'll be able to look at our physician notes and operative reports. So I think all of this information and the ability for you to have specialties join you at your visit and address your issues, I think is making the care of our cancer patients better. And then the last tip is a really important one. Next slide. And it has to do with emergencies. So if we can go to the next slide. So one of the things that we have found during COVID for other diseases is that people have been afraid to go to the hospital and have stayed home. And the same way We have patients that have been afraid to come to the cancer center and stay home. And there are things that, we have done our best and really made it very safe for patients to make it very safe for patients to come to the emergency room, to come to our clinics. We're spacing we're practicing social distancing, and we're spacing patients' visits so that patients, I think right now in our clinic, you won't see more than 2 patients at a time or 3 patients at a time in some of our offices, because we're really trying to practice social distancing. But there's still things that you won't be able to address by telemedicine. And these are emergencies that you can call us and we'll direct you. But some of them are very serious. If you have fevers, I wouldn't want you to wait until a telemedicine consultation. This is something that you will call ahead of time, and we will guide you if this is something that we can manage from home or we need you to go to the emergency room. And it is safe to go to the emergency room even during COVID. Our hospitals have done the census has gone down, and we also have done a good job of separating patients so that they don't get exposed to other patients with infection. Sudden chest pain can be a cardiac condition that may be an emergency. So again, reach out to us and we'll guide you if it's something that needs to be addressed in the emergency room. If you're someone who's having a very sudden difficulty in breathing, this can also be an emergency, and we will need you to go into the hospital for some of this to be evaluated appropriately. If you have any sudden weakness, motor weakness, arms or legs or slurred speech, that could be a sign of a neurological event. And that's something that needs to be addressed in the emergency room, or any uncontrolled bleeding. So there are things that, we still need you to reach out to us, and we still need you to go to the hospital for. But for the regular cancer care, the monitoring of your symptoms and addressing your concerns, the telemedicine virtual office has really made a big difference. I never had telemedicine visits with patients until COVID came, and I really think has changed my practice forever. We have patients that have felt comfortable, and we have continued to do like 2 telemedicines and then a 1-person visit. And we have patients that have chosen to do in-person visits all the time. But I think during this time that we're trying to keep you at home, protect you from infection, has been a great tool. So I will end it at that in terms of just the tips that I wanted to give you from my perspective, but we want to hear from you.
Thank you. Thank you. You are exactly right, Dr. Rodriguez, because this is the time for our Q&A now. So you still have plenty of time, and we're here for another 20 minutes, folks. So enter your questions in the Q&A chat feature. But this presentation was so important. And as you can see, there's the contact information on your screen. You can either go to the website, sylvester.org, to schedule an appointment, either in person or virtual, or call the number on your screen, which is 1-844-324-HOPE. HOPE is 4673. And some of the questions that we're getting are so critical for people who might not be very high tech. So for instance, what kind of basic technology does someone need at home as a patient to have a telemedicine visit? Is a smartphone enough? Is a particular browser, Safari versus Chrome? What are the basic technical needs that a patient needs is our first question.
So we want to work with what you have. I mean, ideally you want to have a device that has a camera. So you can have either a phone that has a camera, an iPhone, or another phone that has a camera. That would be sufficient. Sometimes it's easier to run it through a laptop because you have a bigger screen. So patients can sit and more comfortably sit and talk to the doctor for a long period of time in a computer screen, or a lap, just an Apple type iPad screen. But all of those are okay. And the browser for the Zoom visits is you can search them through most of the browsers. So it's not about the browser, it's about you reaching the patient portal, the portal, and being able to log in with your unique ID so that it's a private Zoom visit. So that's our preference, that you do it through the portals, because everything will be recorded and collected that way.
Okay. If someone has a regular appointment, can they switch it to a telemedicine appointment? Is that easy to do?
That's very easy to do, because if we're waiting for you and you don't show up, we'll call you and we'll be like, can we do this by telemedicine? So we've been able to do that. Our system can transform the visit into a telemedicine visit. However, if ahead of time, if you know you can't come in, just let us know and we can transition to a telemedicine visit. That's not a concern. But it's best to know ahead of time because our nurses usually will reach out to you about half an hour before the visit so they can review your medications. So it's easier for us because we have many patients that we do one after the other. So it's better for us to know what we are expecting so that our nurses can get all the information they need right before the visit.
Okay. We end our slideshow, but that's fine. I think we're all on screen now so we can continue our chat. How about, we always heard that cancer patients are at higher risk within a COVID environment. What are we doing at the clinics for an in-person appointment to mitigate the risk of COVID-19 for cancer patients?
Well, I have to say, and Dr. Penedo can talk to this as well, but I have to say I'm so proud of Sylvester. You know, when COVID started and we were all staying home, one of the safest places to be for me was the Deerfield office because they were, from the day one, they closed access to only the patient that needed to be there. And they screen the cars coming in. So that's one of our facilities we can do that. We can screen the cars coming in. So we're not letting, we're limiting the contact that you will have with other people in the hospital. We also, for patients that need chemotherapy, we require a COVID test right before you go in for your chemotherapy so that it protects you and it protects everybody else. And the hospital has been doing the same for other procedures. You go in, you get a COVID test right before you go in so that we're all are protected. And in the clinic, you know, the telemedicine has really allowed us to see as many patients that we need to see and have less people waiting in the waiting area. But if you do come to the waiting area, we're spacing out the visits and the spaces are organized in a way that there's social distancing.
One of the questions that I'm sorry, Dr. Penedo, go ahead.
Oh, I can hear you. Now you are.
Unmute Dr. Penedo.
Yeah, oh, there you go. Yeah.
This is comments about what Sylvester has done to mitigate the risk.
Yes. So one of the questions I think that people have also when they show up at the hospital is if they're wearing their own mask, they're issued another mask, are they not? And this is all part of the safety measures in place, right?
Likely part of the safety protocols. You know, we have to assume that not 100% of individuals visiting are going to be following the protocols as mandated. So we're not quite sure if that mask that the person brings in has been used throughout the day, may have been exposed to the virus through other interactions, even while keeping social distance and taking precautions. So to be on the safe side, what the attendees referring to is the practice of just giving a brand new sterilized clean mask when they walk in to the clinic.
Right.
And also we give, the staff also is getting new masks, you know, because you also want to be protected from the staff. So we're all getting new masks and we also have protective equipment that makes it safer for the patients as well and for the healthcare providers.
Is a patient able to talk to a nutritionist over telemedicine as part of their cancer treatment at Sylvester?
They can. They typically, those patients may interact first through the patient portal, which has a check of practical needs, and they may state that they want to talk to a nutritionist, and a referral would be generated automatically, or if they ask their provider, that can be arranged through social work and nutrition.
Dr. Rodriguez, yes.
Yeah, I mean, that's essential. I mean, I think being able to provide the tools you need to be able to do well during your treatment, and if you're losing weight, to be able to get you back to the way that you need to be able to continue your treatment is important. So yeah, you can ask for this ahead of time before you even meet the doctor, or when we meet, we will make a referral and they will call you back and make an appointment.
As part of cancer treatment and even in other specialty areas, meditation and the whole mental health and de-stressing is such an important component. Can someone, as part of their telehealth, do meditation or yoga or anything through Sylvester? Is that available?
If the patients visit our cancer support services,
website, through our Cancer Center portal, they will be able to see a full schedule of cancer support services. Within that schedule, we have a variety of services that have moved now to telemedicine, including stress reduction, meditation, mindfulness, yoga, and other components. I think I mentioned earlier music therapy, things that we did not imagine providing through telehealth, but now are doing so.
Yeah,
That's
I mean,
important.
it's very important. I mean, I do think that we all miss some of the personal contact, and even in some of these activities that are, when you do meditation and you come into the center, sometimes there's a whole social component to it that now is limited, but we've been able to really connect, and support groups are still going on. Patients are able to make these connections virtually. And I think it's being important for your treatment that these things are not canceled, that we are able to provide them virtually.
Mhm. I wonder if, given the stress of a cancer diagnosis and the ongoing treatment being, one of the highly difficult times of our lives, if having a telemedicine appointment with that patient and their family member nearby or a loved one also, in a sense, makes this virtual visit even more accessible to others.
Yeah, I mean, I seen that, now we're not allowing family members to come into the room because of the social distancing and all the precautions. So sometimes the telemedicine is more open, like you have more participation from family members. However, if you do come for an in-person visit and your family is waiting outside, we will also connect with them through the mobile device so that they could be part of the visit. And we'll do our best to make sure that we answer all the questions from the family.
Do you think that telemedicine is now here to stay in a post-COVID world? Dr. Rodriguez, you had not had an appointment like this until COVID, and here we are in our new reality. And will the level of these appointments remain the same or even increase in the future? What do you think?
I would like to hear from Dr. Penedo, because I think we're going to get better at doing this. I think we're going to get better about the glitches of the technology, or being able to monitor patients in a better way. So I think it's going to get better, and it's going to continue. It's not going to replace what we do in the office. Patients still need to come in for treatment, and we still need to examine them, but it's going to complement what we do going forward.
I mean, I think it would be a complementary or ancillary service that's here to stay. We all want to provide the best possible care and service to our patients, and there are glitches. The system is not perfect. We've had to adapt very rapidly to the changing landscape of care due to the pandemic. So in a way, we still continue to improve and get better at doing this. Post-COVID, post-pandemic, I fully believe that these services are going to stay as complementary services to patient care. And that's where we could see the added value and added benefit of telemedicine, where you're going to have more continuity of care, better follow-up, addressing barriers that may have interfered with the patient actually coming in for care.
Yeah, I would guess that the last thing that either you professionals would like to hear is that a cancer patient puts off their treatment or anything out of this fear of, oh, I can't get to the technology or something. So please give them a message tonight in heartfelt, explaining the importance of not doing that.
So a passion of mine is lung cancer screening, which is really only utilized in 4% of people that need it in the United States. And the rates of screening have gone down by 60%. So the lung cancer screening rates during COVID have been almost zero. And it's really critical, because if we have ways of finding cancer early and curing people from cancer, offering them a curative surgery, and we're not doing that, and patients are not coming in, we're going to see cancer rates go up. And we're all very concerned about the decrease in mammogram screening, decrease in colonoscopies. And it's important that patients, don't put that off, that even if we have social distancing, you can come in for your screening test. And now that you have telemedicine, maybe you'll be able to make it easier. Like our navigator for lung cancer screening, we used to have the patient come in and do a visit to talk about the screening before the actual test. And now we can do that by telemedicine. So that saves you a visit. So I think it's very critical if we want to, all the advances that we have had in cancer survival, a lot of them have to do with screening. So we have to get back to seeing our patients and detecting cancer early.
Yeah.
To speak as a psychologist, I'm always very concerned about the emotional well-being and the psychological adaptation of our patients who are going through extraordinary circumstances when facing cancer. And the message is that in many ways, we're all in this together. The care providers, all the way from cancer support services to medical oncologists, are really here to do their best and to work with you. It's okay to be fearful. It's okay to feel anxious about having to shift to this new technology or these new systems, but be assured that everyone has their heart and their mind in the right place to take them through this. So the last thing we would want to see is for a patient to disengage from their care because of the technology or telemedicine.
Absolutely. And some things cannot be done except in person, of course, such as a mammogram, as you said. But one patient just threw us a question saying, can a lesion somewhere in the body be seen in the telemedicine appointment? Perhaps so?
There are things that you can take pictures. We have really good cameras in our phones now, but we still need to have you come in. We need to examine you and do a full exam if there's an abnormal finding. And it's safe to come in to do that. It's important.
Yeah, but at least it's a start, like you say, at least start
yeah.
Open the conversation.
Or sometimes what has been useful is that if you communicate a new finding and you send us an image, we're trying to expedite things for you. And we do a great job of that at Sylvester, of working together. So sometimes we share pictures, we have an initial talk, and then we send you directly to a surgeon for a biopsy. So we're able to save time really by having these conversations.
Yeah, and I think the same can be said on the technical side. You mentioned, Dr. Penedo, that you have staff and there are people in your offices that if a patient cannot figure this out, you can help them to set this up prior to their appointment, right?
Yeah, we have, yeah. Mm-hmm. Mm-hmm.
Perfect. Well, I think that this was extremely valuable for all the people who tuned in tonight and that participated in this conversation. Like you say, we're all in this together. So Dr. Rodriguez and Dr. Penedo, you were excellent. Thank you so very much for your time and the generosity of your time with us tonight. We want to thank all of you in the audience, and we also want to ask you to fill out or complete the survey at the end of this chat. It's going to come up for your availability, and also there on your screen. Let's reiterate that again. To schedule an appointment in person or virtually, visit sylvester.org, or please call our phone lines 1-844-324-HOPE 4673. And we hope that you've enjoyed this conversation and that it was valuable to your life. Thank you again, Dr. Rodriguez, Dr. Penedo. Good night.
Sure.
Thank you all.
Thank you.
And be safe out there, everyone. Take care.
Bye-bye.